Minister of the country, that he comes to Nagaland only for vote, and that is coinciding, this press conference has coincided with his visit today in Nagaland, which is for the campaigning purposes for the BJP as well as for the NDPP. The Congress has also stated that the health infrastructure in the state is in shambles and they need to give an answer, as reports are all fake and whatever is being revealed to the public is not true. So let's have a look at the press briefing.
We need to ask certain questions on behalf of the people of Nagaland, because you cannot have a one-way traffic. You cannot have the Home Minister talking about Jal Jeevan Mission, the roads, the development, the health sector, etc., etc. And that includes especially the Ayush Atalman Yojana. When he has come here, I am going to refer to a report from 2021. You know very well that this government does not share data, and the data that it shares comes with great difficulty. So this 2021 ICMR, National Center for Disease Informatics and Research, this is chapter 7, and this is about Nagaland, and this exposes the health department of Nagaland. Why is it in shambles? Because the double engine Sarkar has given a lot of information in this report, and in this report it shows its I don't care attitude. How? Because it says that there are 397 SC, 56 HWC SCs, 126 PHCs, 05 HWC PHCs, 21 CHCs, 11 DHs. But what they are hiding are certain facts. They have also said there is one tertiary cancer center. The state is covered under Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, ABPMJAY. But when you actually look closer into this report, my dear friends, the truth is revealed further. What is the truth? The truth is that there is no sub-district hospital under the tertiary healthcare facilities, and they have put this over there. There are 0 medical colleges, 0 state cancer institutes in a state where cancer is rising rapidly. And you know that there are lots of cancer patients. But we will come to that in just a minute. There is a 0 regional cancer care center and only 1 tertiary cancer care center. Lessons. That is the sorry state of affairs today. This is a double engine ki trouble engine Sarkar. And when you talk about data for Ujjwala Gas Yojana, this is the report that needs to be referred to. Because you know what they have said is, they have made it lucid that only 24.9% rural households have clean fuel for cooking. So you don't have clean fuel for cooking, you get unwell, there is no jal in the nulls, and there are no nulls for long distances. So when there is jal, the jal that people consume has iron, arsenic, and God knows what all contamination. That is also one of the reasons for the rising cancer patients in Nagaland. But nobody has an answer to that. However, let me also give you another data. 345 children between the age of 12 to 23 months have not received immunization with penta and hepatitis B vaccination. I beg your pardon, 34%. 34% children have not received immunization with penta and hepatitis B vaccination. And closer home means better facilities. Where? In Dimapur, of course. But Dimapur District Hospital, which caters now to 3 districts, the districts of Chumukadima, district of Newland, and district of Dimapur. What has happened over there? We know power cuts are rampant in the state. No matter who says what, when you need good health care, people from remote areas will also come to Dimapur. But first, their bones are going to get rattled while they are traveling right to Dimapur. After that, once they are here, there is no Jal Jeevan Mission. But I am going to show you some visuals from 18th February 2023 of District Hospital, Dimapur. And what does it show? It shows power cut. The facade shows a power backup is present for the front portion of the hospital. When you enter, there are lights. And when you go to other parts of the hospital, there are no lights. Can you imagine that, my friends? I'm sure all of you living in Dimapur know this. But this is a question that needs answers from the state government of BJP and NDPP led by Mr. Rio. And it also requires an answer from the Home Minister Amit Shah, who is visiting Nagaland today. In the hospital, nurses treating patients in candlelight. Yes, my dear friends, candlelight. And of course, if these visuals are anything to go by, it just means that Mr. Amit Shah comes here for votes because, like the BJP likes to proclaim, they are 365 days, 24/7 in election mode. But they cannot give governance. They cannot give facilities. And this needs an answer. Why has Nagaland been left in such a state? Has nothing been learned from the COVID onslaught? Has Mr. Amit Shah, Mr. Narendra Modi, Mr. Rio, who talk big, but on the ground when there is nothing, do they have answers for the people of Nagaland? For the health sector, the people of Nagaland are waiting for answers. For the Jal Jeevan Mission, the people of Nagaland need answers. And now let me show you what I've got for you, my dear friends. And this is alarming, because if in a state where you have a double-engine sarkar and you do not have facilities, it just goes to show that the government does not care. Rio says, I don't care. Narendra Modi ji says, I don't care. And Amit Shah ji is saying today, I don't care about you.